The number of measles cases tied to the West Texas outbreak has now surged to 400. It is one of the biggest jumps in cases yet and includes new cases northeast of Dallas. Local officials fear federal cuts could impact vaccine outreach efforts. And Fox 4's Casey Stiegel is in studio now with more. Casey.
Yeah, Heather, good evening. Health officials say the measles outbreak remains centered around the West Plains and Panhandle region of West Texas. There are now 11 cases in Lamar County, that is northeast of Dallas, that have been linked to that region, and statewide the total number of cases do continue to tick up, and it comes at a time when federal cuts are being made to public health.
Measles misgivings continue to spread across parts of the Lone Star State. On Friday, the number of cases jumped to 400 since the outbreak began in January, 73 more than DSHS reported on Tuesday, representing a more than 23% increase.
You start looking at those peaks, you'll start to see in that data those epi curves, and that is what we're seeing in that Texas data. Every 7-10 days or so, you're seeing spike, spike, spike.
Dr. Diana Cervantes is an infectious disease expert. She tells Fox 4 one reason the numbers don't seem to be going down is thanks to how highly transmittable it is and for how long.
With measles, it's contagious first 4 days before you have the rash and then 4 days after. So that's a pretty nice window there.
Nearly all of the patients are unvaccinated children, which is why in recent weeks there has been a major push among local health departments to get folks immunized.
We've actually been working with some of the schools and school districts that have low vaccination rates and sending staff out to help get their vaccination rates up. And
Dr. Philip Wong heads up the Dallas County Health Department. He warns recent cuts to U.S. Health and Human Services to slim down the federal workforce at the request of President Trump is already trickling down.
We're assessing the exact magnitude of it and looking at how we're going to be able to try to, move forward. But definitely there's significant cuts that we're facing.
Dr. Wong says they're already looking at scaling back how many vaccines they can provide.
In an age with measles, with H5N1, the bird flu, all these things, these are what we need to be prepared for, and this drastically affects our ability to be able to be prepared.
All right, so DCHHS did receive a federal grant to buy more lab equipment and expand the county's ability to test more patient samples for different diseases. That too now on the chopping block due to those DOJ ordered reductions.